Carpenter syndrome of newborns. What are congenital syndromes? Congenital syndromes are genetic conditions present from birth that result from mutations affecting embryonic development. They are usually inherited in autosomal recessive or dominant patterns, depending on the gene involved. Studying these syndromes enhances our understanding of how genetic signals guide normal human morphogenesis, and how their disruption leads to recognizable clinical patterns. Many of these disorders involve the bones of the skull, face, hands, and feet, leading to distinctive physical features and, at times, functional impairments. Such syndromes often share key features like craniosynostosis. It is the premature fusion of skull sutures. Polydactyly. These are extra fingers or toes. Syndactyly. These are fused fingers or toes. Facial dysmorphism. These are abnormal facial shape or proportions. Growth and developmental delays. Today, we will focus on one such rare condition, Carpenter syndrome, which beautifully illustrates these principles. What is Carpenter syndrome? Carpenter syndrome is an extremely rare genetic disorder, characterized by craniosynostosis. It is the premature fusion of skull bones, leading to a pointed or tower-like skull shape. Carpenter syndrome belongs to a group of conditions called craniosynostosis syndromes, where the bones of the skull fuse too early, leading to abnormal head shapes and facial features. Carpenter syndrome is also known as Acrocephalopolysyndactyly Type II, as it is a rare genetic disorder that affects the development of the skull, face, hands, and feet. Acrocephalosyndactyly is a congenital disorder characterized by a tall, peaked skull, known as acrocephaly, due to the premature fusion of skull sutures, and webbed or fused fingers and toes, known as syndactyly. Is Carpenter syndrome genetic? Yes, Carpenter syndrome is a genetic disorder, specifically one that is inherited in an autosomal recessive pattern. This means a child must inherit a copy of the mutated gene from both parents to be born with the condition. If both parents are carriers, there is a 1 in 4 chance with each pregnancy that their child will have Carpenter syndrome. While it is inherited, it can also occur sporadically without a family history due to a new, random gene mutation. What causes the mutation? Carpenter syndrome is caused by mutations in specific genes, most commonly the RAB23 gene, or MEGF8 gene. These genes are crucial for the normal growth and development of bone cells, and mutations in them can lead to the characteristic features of the syndrome. Who discovered Carpenter syndrome? This syndrome was first noticed by George A. Carpenter, a pediatrician, in 1901. With 2 sisters. However, the syndrome was officially named after Dr. Carpenter in 1909. After the sister's brother was born with a more severe expression of the syndrome. What are the features of Carpenter syndrome? A baby with Carpenter syndrome can show following features. Craniofacial features. Premature fusion of skull bones, leading to a pointed or tower-like head. This is known as acrocephaly. Other features can include flat nasal bridge with epicanthal folds, down-slanting palpebral fissures, corneal anomalies, low-set, posteriorly rotated malformed ears, an underdeveloped maxilla and mandible. Limb abnormalities. These can include syndactyly, webbed fingers or toes, polydactyly, extra fingers or toes, brachydactyly, short fingers or toes. Cardiac defects. Congenital cardiac malformations are frequent and may include ventricular septal defect, patent ductus arteriosus, pulmonic stenosis, teratology of Fallot, transposition of great vessels. Intellectual disability. Intellectual disability is common, affecting 63 to 75% of cases. Genital abnormalities. Males often have genital abnormalities such as hypogonadism and cryptorchidism. Teeth abnormalities. Small primary dentition is usual. Teeth are short, undersized and widely spaced, appearing as small buds worn to the gingival margins. And often there is prolonged retention of primary teeth. Growth abnormalities. Growth is either slightly delayed or normal, and many individuals have short stature. Persistent obesity, particularly truncal obesity, beginning in childhood is common. Additional skeletal abnormalities. Additional skeletal abnormalities such as deformed hips, kyphoscoliosis, and genu valgum frequently occur. Additional other abnormalities. Cetus inversus, dextrocardia, and polysplenia has been observed in a few patients.